Good evening to all the viewers who are watching live and will be watching on the recorded version. It's me, Orko Mukherjee, your IT manager, and we have started the process. Means we have restarted the process of e-participation certificate, auto-generated e-participation certificate. Who will be attending this CME via YouTube live? So yeah, all you have to do just click on the link given below. And this CME isn't being streamed on Facebook and Twitter since there is some issues with the StreamYard group, and we, the IT team, are trying to fix it out. So, without wasting any more time, let's just jump onto our 30 seconds countdown time. Kalyani sir, it's off to you since one of our hosts is unavailable right now. So it's off to you, sir. Over to you, sir.
Good evening to all the viewers, brilliant personals of National Homoeopathy alumni on the screen, especially today's speaker, moderator, and inaugurator. So, without wasting time, let me request our moderator, request our inaugurator of the program to inaugurate the session of the day.
Sir. Thank you, sir.
Dr. Sudhan Dhar.
Sudhan Dhar.
Sorry, Sudhan Dhar.
Okay, sir. Good evening, everybody of N.I.H Alumni. It's my privilege to inaugurate 82 CME. Myself, Dr. Sudhan Dhar. I'm the second batch of N.I.H. Today's topic is role of pH balance in diet. It's not our subject, it's Materia Medica. We are mainly doing with Materia Medica, but it's a biochemistry subject. Still, we have to do something with biochemistry and physiology because the how hydrogen potentiality is working in our diet, we have to go through it. We have two eminent speaker and moderator, Dr. Jagmati Singh and Professor Abdul Molla, who will help to educate us about the role of pH in diet. Now I welcome Dr. Jagmati Singh to give her speech on.
I'm sorry, sir. It will be moderator, sir, on screen first. Sorry to interrupt in between.
Okay. Then I will. Hello. Please.
Yes, sir. Yes, sir.
Okay. Please, Dr. Molla, you start your as a moderator.
Thank you, Dr. Dhar, for introducing myself. I feel proud and privileged for giving me the opportunity to moderate this scientific session of our mother institute, N.I.H, on behalf of this for N.I.H Alumni Association. And today, the 82nd session of this CME, it's a great, the achievement indeed, continuous without any break. This 82 session, it's a big achievement for, and this is possible only for this consistent and persistent effort of the president, secretary of our association, Dr. Kalyani sir, Dr. Bidyut Mukherjee, and of course, it would have not been possible without the active participation of all these viewers across the globes. And it is not this viewers; they are not merely this ex alumni of this our institute. Apart from this, the other institute, the homeopathic lovers, so they join this session, and even a large number of this participant from Delhi, from my college, they also regularly participate to as a viewer in these sessions. So the today's topic, this before going to the topic, let us just introduce our speaker. Today's speaker is Dr. Jagmati, who is the from BHMS from 2005 batch. She has completed her BHMS from N.I.H in 2005, and after that he has an experience of 2 years in charitable dispensary. After that, he has completed her certificate in food and nutrition course from IGNU. After that, he joined one homeopathic chain in Delhi, where she worked for 1 year. After that, she joined the Batraj multi-speciality clinic in Delhi, where she successfully worked for 6 years. And there's even a few of her cases that was published in the monthly magazine of this Batraj clinic. And after that, she has started her homeopathic clinic in one of the very posh area of Delhi, that is at Basant Kunj, where it's really very difficult to run a private clinic. And side by side, what we becoming usually a homeopathic practitioner, do we want to confine ourselves with this homeopathic medicine only, prescribe only homeopathic medicine, and we feel that is our only duty. But she has this one experience, this certificate degree in food and nutrition, and she is practicing and she is applying her knowledge of food and nutrition in addition with that of the homeopathic treatment. And as per my conversation with her, so this use of this knowledge of food and nutrition, so that has helped a lot to this her patient for regaining health, so to cut short the time of recovery. So how this is, we will learn a lot from this thing. And for the today's topic is the pH balance in diet. So it is so new that even the first time when I heard this topic, so I had to search, I have to discuss with the dietitian of our hospital that what it is about. And then I searched few book and all this online, and all this thing we will learn from the Dr. Jagmati. She will be this best person to discuss the all this thing details of this pH balance in diet. And after that, if you have any question, it is everybody, you will please ask your question. So now, without wasting much more time, because every viewer, they don't want to hear from me, they want to hear from Dr. Jagmati. Now over to Dr. Jagmati. Dr. Jagmati, please.
Please wait, sir. I guess there are some issues from Jagmati ma'am's end. So he is just left and he will be joining soon. Until then, viewers and sir, please just hold on few more minutes until ma'am joins.
Okay, so this is a new topic, and this thing, it is very, as it is very new, it is many things, it is very difficult to accept. And there are, it is a like the hypothesis in this dietetic science. So there are the proponent of this theory hypothesis, and there are the people who they just think opposite. They think it as the myth. They think it is usually it is irrelevant, and it has some adverse effect. So whatever the pros and cons of all these things, so everybody, we are waiting to learn from Jagmati, and hope within a minute she will be able to join and enlighten us with her experience and the knowledge. Jagmati, over to you.
Okay, sir. Good evening, everyone. Thank you, Kalyani sir, Dr. Bidyut, Dr. Pradesh Sharma sir, Dr. Abdul sir, Dr. Sudhan Dhar sir, for encouraging me for today's topic. And thank you for allowing me to share my experience with some of the patients where I did some dietary changes along with the homeopathy treatment in some of the chronic diseases. Few days ago, I was listening to one of the lecture of Sunirmal Sarkar sir, where he was telling how to read Materia Medica. And he told that to study a drug, one has to know the physiology, biochemistry, history, and botany of that, so that you can have a very good idea about it. The same thing we have done in our college to know about the diseases. Its physiology, biochemistry, pathology, all this we studied in our medicine. So I tried the same to study about the nutrition actually. I was able to see that persons patients are getting better, but after few years they come back again with the same complaints. And I noticed that what is there common in everyone. So I came to the conclusion the food everyone is eating is very common to most of us, like wheat, milk, fat, sweets, non-veg. We everyone was eating almost same kind of things. So today's topic of the pH balance in diet and in health actually I have divided for easy understanding it into three portions. First is the normal physiology of the pH balance. Second is the importance or when it is disturbed, how the diseases are formed inside the body. And third is the treatment part. So I have divided it into different segments like diet as per Master Henneman, things to be avoided, pH of the blood and urine, some observation which I saw before starting with my patients about the diet changes, some published data, and some disease conditions. Then, how to maintain the pH, and along with that, some videos I will share. So, I'll start with the introduction. In 1903, Thomas Edison was concerned about the healthcare of his time, and he stated, "The doctor of the future will no longer treat the human frame with drugs, but rather they will cure and prevent diseases with nutrition." As we all know, diet and regimen play an important role, as a wrong diet can make a healthy person sick, while a correct diet can help to recover to the health again. In homeopathy, the aspect of diet and regimen is very significant, as already said by Master Henneman. This idea is even accepted by modern science today. So let us discuss here diet with a different viewpoint actually. One must choose a diet that goes best with his food habits. Make it a habit and part of the lifestyle over a period, not a stint for 3 days. If someone is eating rice, there is no problem with it. But one has to make sure that he add a portion of the vegetables, fruits, proteins also, so that the balance of pH can be maintained. A diet as per Master Henneman is already mentioned in aphorism 259 to 265 as diet and habits of life. He has mentioned in aphorism 260, hence the careful investigation into such obstacles to cure is so much the more necessary in the case of patient affected by chronic diseases, as their diseases are usually aggravated by such noxious influences and other diseases causing errors in the diet and regimen, which often pass unnoticed. In aphorism 261 Organon, he has mentioned the most appropriate regimen during the employment of medicine in chronic diseases consists in the removal of such obstacles to recovery and in supplying where necessary the rewards. Innocent moral and intellectual recreation, active exercise in the open air in almost all kinds of weather, like daily walks, slight manual labor, suitable nutritious, unmedicinal food and drinks, etc. We all are aware he has mentioned what not to take in the diet, like coffee, Chinese, herbs tea, beer, brandy, wine, spiced chocolate, odorous water, raw onion, garlic, mint leaves, crude vegetables for soups, tobacco, snuff, smoking, spiced cakes, strong sauces, and meat in the state of decomposition, sour and acidic fruits. In the regimen, also, he has mentioned one has to avoid sedentary lifestyle in the close apartments, unnatural debauchery, overexertion of the mind and body, strong scented flowers and perfumes, continuous in lying down position, too much heavy exercise, dwelling in marshy districts, damp rooms, uncleanliness, overheated rooms. All this can lead to or can prevent from the patient to get better. All these things has to be avoided for a better cure of the patient. Before we start with the topic, let us understand few points about the pH. pH in the human body is very important. Let us start with the physiology. As we all know, the physiological pH of the human body is essential for many processes necessary to life, including oxygen delivery to tissues, correct protein structure, and innumerable biochemical reactions that rely on the normal pH to be in equilibrium. Every organ system of the body relies on the pH balance. This pH is maintained by some buffers in the body. The renal system and the pulmonary system are the two main modulators of pH balance. In blood, buffering is done by the bicarbonate. In the kidney, it is done by phosphate. Now let us know the some ranges or what is normal pH of the blood so that we can understand what is abnormal. According to chemistry, pH less than 7 is acidic, above than 7 is alkaline. So 7 is a neutral parameter. But according to the human physiology, normal blood pH value is 7.35 to 7.45. So any decrease or increase from this range is a problem. There are two types of imbalance. One is respiratory, which depends on the carbon dioxide concentration in blood. Second is metabolic, which depends on the bicarbonate concentration in blood. Now, if there is imbalance, there are some conditions. We are already knowing about them. In short, let us revise it again. One is metabolic acidosis. It is a clinical disturbance defined as low bicarbonate level. Diseases or the causes are diabetic ketoacidosis, severe dehydration, renal failure, renal tubular acidosis. Second is metabolic alkalosis. It is defined as a disease state due to high carbonate level, secondary to some metabolic processes. Here the causes are prolonged vomiting, hypovolemia, diuretics, and hypokalemia. Third is respiratory acidosis. It is a state where there is failure of ventilation and due to it accumulation of the carbon dioxide inside the body. The causes are asthma, COPD, pneumonia. Fourth is respiratory alkalosis. It is a pathology secondary to hyperventilation, which occurs in response to hypoxia, metabolic acidosis, pain, or anxiety. Second is after knowing the pH of the blood, now let us know the pH of the urine. These are our two main fluids in the body. Urine has the widest range of pH compared to other bodily fluids. Ideally, the pH of urine should be between 6 to 7.5, but a wider range is usually acceptable. Any pH higher than or lower than is again a problem. Now, how to understand or What all conditions can create abnormal urine pH? There are several factors that can affect the pH of urine. First is diet, which is our today's topic. What we consume on daily basis can affect our urine pH. There are some medical conditions. The existence of medical conditions, known or unknown, can affect the urine pH. I will list few conditions: kidney stones, diabetic ketoacidosis, dehydration, starvation, diarrhea, chronic inflammations. Here it is seen association of acidic urine pH. These are not the acidic urine pH is not the reason for this diseases to develop, but it is an association. By what we can calculate the acid level in the blood and the urine. In the blood, arterial blood gas is a laboratory test. It is used for measurement of the arterial pH, the arterial partial pressure of oxygen, carbon dioxide, bicarbonate, total CO2 and O2 saturation. In the urine, pH is commonly used for chronic diseases. Today's idea is also, as per NCBI, National Center for Biotechnology Information, they have observed that low urine pH is associated with several metabolic diseases such as dyslipidemia, diabetes, kidney stones, non-alcoholic fatty liver disease, chronic inflammation, etc. But low urine pH is not the cause of all these conditions. This observation can be used for this for many conditions to prevent and for the betterment in a faster way. Few can be reversed by knowing this idea in advance. Food that can affect the pH of urine, what we consume on the daily basis. So they are basically high carbohydrate food, sugary food, sodas, refined wheat flour, and milk products. It is observed by NCBI. Now I want to share some facts on the research by the different journals. One is diabetes mellitus. As per the World Journal of Diabetes, published on 2015 February, article name is Role of interstitial fluid in the diabetes mellitus, glycolysis, and mitochondrial function by Yoshinori Muranaka. They have said, for example, severe diabetes mellitus causes ketoacidosis, detected as lowered pH of arterial blood, even when containing strong pH buffers such as hemoglobin and albumin. They have concluded, I have recently found that the pH of the body fluid is lower in diabetes mellitus than that in the non-diabetic control, and that the lowered pH is one of the cause producing insulin resistance. This information is by the National Center for Biotechnology Information. Some few points about the diabetes I want to share again. Type 2 is a diabetic metabolic disorder. India has the second largest number of diabetes worldwide. According to an estimate, over 74 million Indians were diagnosed with diabetes in 2021, and this is expected to rise to over 124 million by 2045. Complications is diabetic ketoacidosis. This is one of the complications. There are many other. DKA is characterized by uncontrolled hyperglycemia, metabolic acidosis, increased body ketone concentration. This develops when body does not have enough insulin to allow the body sugar to, to be utilized by the cells for energy. And instead of this, liver breaks down for the fat and produces ketones in the body. With low glycemic index food, all these conditions can be easily avoided. and diabetes level can be kept in a good range. Now I want to share second part like renal stone research. As per the American Journal of Kidney Disease, article by Shalini T. Reddy, MD. Article name is Effect of Low Carbohydrate, High Protein Diet on Acid Base Balance, Stone Forming Propensity. Here, 80 volunteers were screened for the study. 10 healthy participated in the study. And data shows that such a diet, low carbohydrate, high protein, provides an exaggerated acid load, increasing the risk for the renal calculi formation and bone loss also. Now, the data on the uric acid. As per the Nutrition Journal again published on 2012 June by the Department of Medicine and Molecular Science, Graduate School of Biomedical Science, Hiroshima University. Article name is Effect of Urine pH Changed by Dietary Interventions on Uric Acid Clearance Mechanism of pH dependent excretion of urinary uric acid. Here, 18 female university students were taken, and with the participation, they found that we conclude alkalinization of urine by eating nutritiously well designed alkaline prone food effective for removing the uric acid from the body. Third is non alcoholic fatty liver disease. This is fourth. A recent AIM study which analyzed published reports on non alcoholic fatty liver disease in India states that over one third of Indians have fatty liver or non alcoholic fatty liver disease. There is less known about this condition. In many people, fatty liver itself does not cause any problem at first. It can worsen slowly over time. The extra fat in the liver causes liver inflammation, which eventually leads to fibrosis of the liver, can lead to chronic liver diseases like cirrhosis or liver cancer. Here also, study indicates that NAFLD is associated with low urine pH in both sexes, findings that might help clinicians identify patients at high risk for non-alcoholic fatty liver diseases. Now let us know more about the obesity also. This survey shows that North Indian cities of the Delhi and Chandigarh are the obesity capitals, with 53% of those surveyed being obese. Here the cause again diet more in fatty, refined, processed food, acidic food, lack of exercise, some hormonal imbalances. So in all this we have seen the reason is low reason is acidic food which creates the acidic environment in the body, and we can check it with the low acid value in the urine again. Now I want to share one very important disease which we have already discussed in all these topics, all these diseases which I have already right now discussed. This is the mother of every diseases we can say. Chronic inflammation. Chronic inflammatory diseases are the most significant cause of death in the world. The WHO ranks chronic disease as the greatest threat to human health. Worldwide, 3 of 5 people die due to chronic inflammatory diseases like stroke, chronic respiratory diseases, heart disorders, cancer, obesity, diabetes. The prevalence of some specific chronic inflammations diseases are as follows, which I have just now discussed: diabetes, cardiovascular disease, arthritis, allergies, COPD, obesity, non alcoholic fatty liver diseases, chronic kidney diseases, cancer, etc. Now, what are the risks for this development of all these chronic inflammations? Some factors are associated with it actually. They are not the cause exactly, but these are the associations. Several risk factors promote low level inflammatory response. These includes one is age. Increasing age is positively correlated with the elevated levels of several inflammatory molecules. The age associated increase in inflammatory molecules may be due to mitochondrial dysfunction or the free radicals accumulation. Age related factors, and this also causes increase in visceral body fat. Second is obesity. Many studies have reported that fat tissue is an endocrine organ and it is secreting multiple adipokines and other inflammatory molecules, mediators. Third is diet. Diet rich in saturated fat, trans fat, refined sugar. All these are associated with higher production of pro inflammatory molecules, especially in individuals with diabetes or overweight individuals. Next is smoking. Cigarette smoking is associated with lowering the production of anti inflammatory molecules and inducing inflammation. Then, stress and sleep disorders, both physical and mental stress. It is associated with the inflammatory cytokines release. Stress can also cause sleep disorders since individuals with both irregular sleep induces are more likely to have chronic inflammation than consistent good sleep. Sleep developer disorders are considered as the independent risk for chronic inflammation. I want to share some of the symptoms of chronic inflammation, which are common to many patients, many diseases, many medicines actually. These are body pain, arthralgia, myalgia, chronic fatigue, and insomnia, depression, anxiety, mood disorders, gastrointestinal complications like constipation, diarrhea, acid reflux, weight gain, and weight loss, frequent infections. Many patients come with all these complaints, but these complaints are very much troubling to the patient. So the doctor must address all these complaints also along with the main complaint. Now, let us know how to check the chronic inflammation so that we can prevent it. Unfortunately, there are no highly effective laboratory measures to assess patient for chronic inflammation, and diagnoses are usually undertaken only when the inflammation occurs in association with other medical conditions like already discussed obesity, kidney stone, high uric acid, or etc. Now, the prognosis of chronic inflammations. Untreated chronic inflammation generally carries a poor diagnosis because we all know this can lead to so many other serious conditions. However, timely interventions with diet and homeopathy medicines can result in a good prognosis. Now, let us know how we can remove this acid from our body or how we can maintain our pH balance in the body. For the maintaining both acid and alkaline value within moderation are very much important. Kidney and skin eliminate strong acid such as uric acid, sulfuric acid, and phosphoric acid. These acids mainly comes from the animal protein. And the second is lungs, which eliminate the weak or volatile acids such as citric acid, pyruvic acid, oxalic acid, which mainly comes from the plants. In the form of CO2, it is excreted from the body. Now, let us know some food list which are acidic, which are alkaline, so that we can take care of it or we can manage it actually. Acid foods contains some grains, sugar, processed food, certain dairy products, including cheese, fresh meat and processed meat, already asked by Dr. Henneman to avoid for the treatment of chronic diseases. High protein and supplements, carbonated beverages such as soda and spritzers, animal products. Now, let us know what are the alkaline food or the more healthy food for human body. This includes fruits, nuts, legumes and vegetables, berries, root vegetables, cucumber, carrots, sweet potatoes, etc. Now, let us come to our last part of the pH balance or how to maintain the pH balance. For this, we have to do many things for the treatment actually. Mainly, many diet and lifestyle changes are very helpful for removing the inflammatory triggers and for reducing the inflammation. So, this includes low glycemic index food. A diet with high glycemic index is related to high risk of stroke, coronary heart disease, type 2 diabetes mellitus. This we all are, everyone, even the other people in the society, except the doctors. Everyone is aware of it and everyone is taking care about it now. So, by reducing intake of the total saturated fat and trans fat, some dietary saturated and synthetic trans fats aggravates inflammation, while omega-3 polyunsaturated fats appears to be anti-inflammatory. So we have to add all this. Fruit and vegetables like blueberries, apples, Brussels, sprouts, cabbage, broccoli, cauliflower, which are high in natural antioxidants and other anti-inflammatory compounds, may protect us against the inflammations. Then fiber. High intake of dietary soluble and insoluble fibers is associated with lowering level of interleukin 6, TNF alpha, and next is nuts. We all love nuts and we are fortunate that they even help for reducing the chronic inflammation and reducing the risk of cardiovascular disease, diabetes, etc. There are other things also like green and black tea polyphenols. Tea polyphenols are associated with a reduction in CRP in humans. In clinical studies, it has been seen. Curcumin, a component of the turmeric, has also shown to be associated with significant improvement in the several inflammatory diseases in animal models. We all are very much aware of it, and many times we advise to our patients. Fish oil, the richest source of omega 3 fatty acids. Higher intake of omega 3 fatty acid is associated with lowering the level of TNF alpha, CRP, interleukin 6. There are micronutrients which many times we ignore actually, or the patient ignore, or they take only when the doctor advises them. Few are magnesium, vitamin D, vitamin E, zinc, and selenium. Magnesium is listed as one of the most anti-inflammatory factor and its intake is associated with the lowering of high sensitivity CRP, interleukin 6 and TNF alpha activity. Vitamin D, it exerts an anti-inflammatory activity by suppressing the inflammatory mediators such as prostaglandins and nuclear factors, kappa, light chain enhancers of activated B cell. Vitamin E, vitamins E, zinc, selenium. All this acts as antioxidants for our body. Sesame legumes, sesame oil consumption reduces the synthesis of prostaglandins. It is used majorly now in many families due to awareness. It reduces the synthesis of prostaglandin, leukotrienes, thromboxanes, and is known as potentially hypotensive activity. By avoiding wheat, sugar, milk products, 80% in the diet, not replacing 100% but just 80%. So we are lowering the intake of these foods, replacing with natural sweeteners, multigrain like sorghum, corn, barley, pearl millet, soya milk, almond milk, coconut milk can be helped a great. Physical exercises. In human trials, it has been shown that this factor helps to lower the multiple pro-inflammatory and cytokines independent of weight loss. There are some other things which are minor but are very important. For maintaining the pH of the body, this contributes major role. Antioxidants. It helps to remove the free radicals. Prebiotics. It helps to improve the probiotic growth and quality in our stomach, which is very much important for the digestion, absorption, and assimilation. Probiotics. Some of the conditions that might be helped by increasing the amount of probiotics in the body through the food, and in some conditions we give the supplements, which includes diarrhea, constipation. Everyone is aware of this. Enzymes are proteins that acts as a biological catalyst by accelerating chemical reactions. Next is drinking enough water on daily basis can be very effective for deacidifying the body, because we know most of the problems occurs when the internal environment is acidic. Water, if drunk in large quantities and if it is alkaline, then it can neutralize numerous acids in one day only. Now, how to achieve this? For achieving and for the betterment of health, for avoiding the diseases, for helping the disease to get cured in a faster way. This can be maintained by 1 or 2 meals should be eaten with colored vegetables on daily basis. Sometimes we avoid this. We take lots of protein some days. We do not take vegetables on that day. But making an average or making a balance is of great help. At least 2 fruits must be eaten on daily basis. Salads must be eaten 2 times with meals. More refined and processed food must be avoided, including wheat, milk, sugar, at least 70 to 80%. Now, at the end of my today's topic, I want to conclude that with all these changes in the diet and regimen, along with homeopathy, fast recovery in health can be achieved, and this helps to reduce comorbidity by maintaining the pH balance in the body. On these findings, I advised some of the patients to avoid wheat flour, sweet, and milk products, 70 to 80% of their diet, and I felt patient experience was much change in a very short time. I told to replace with natural sweeteners, multigrains, and other type of drinks. All these patients, which are right now, I will share some testimonials. When they came, they were not on any allopathic medicines. They simply suffering from few problems and they contacted me before going to the allopathy medications. Before the patients, all these things which right now I have told, I followed myself and for my family first, because first I get convinced and will be able to follow. Then I will be able to advise it, because the diet which everyone is eating, I am telling them to replace it, which is very difficult for anyone. So I checked it on myself whether I am able to follow it, whether I am able to get some result. And after I get convinced that yes, I am able to follow for some days, for few months, I am able to feel the change, then I advised some of my patients. Now I will share the data, I will share the video of few such cases where the patient will speak for themselves. Along with homeopathy, I did some diet changes which right now I have discussed. Now I want to share the testimonial.
मेरा नाम अलका तनेजा है। मैं दिल्ली में रहती हूँ। मेरी उम्र 54 साल है। लास्ट ईयर जून 2022 में मैंने अपने रूटीन चेकअप्स कराए थे। उन बॉडी चेकअप में से मेरे को HbA1c 8.5 आया और मेरी शुगर भी बहुत ज़्यादा हाई आई, जिसकी वजह से मैं बहुत ज़्यादा परेशान हो गई और घबरा गई। उसके बाद मैं अपने फैमिली डॉक्टर से मिली। उन्होंने मुझे सलाह दी कि आप एलोपैथिक मेडिसिन ले लीजिए डायबिटीज़ की। मैं और भी 2-4 डॉक्टर्स के पास गई, उनसे सलाह ली, तो सब ने मुझे एक ही जवाब दिया कि आप एलोपैथिक मेडिसिन ले लीजिए। उसके बाद मैं डॉक्टर जगमती जी के पास गई। उन्होंने मुझे ये सलाह दी कि आप इसको अपने लाइफस्टाइल से और डाइटरी चेंजेस से इसको ठीक कर सकते हैं। आप एक बार ट्राई कीजिए। उनके कहने पर मैंने अपने डाइटरी चेंजेस, एक्सरसाइज, योगा, वॉकिंग, स्टेयर्स क्लाइंबिंग, वीट को बिल्कुल छोड़ दिया, मिल्क प्रोडक्ट बिल्कुल बंद कर दिए, शुगर बिल्कुल बंद कर दी। उसके बाद लास्ट 6 मंथ से मेरा HbA1c 6.5 से ऊपर नहीं गया। और अभी जब मैंने रिसेंटली अपने टेस्ट कराए तो आज मेरा HbA1c 5.6 पे आ गया है, जिसके लिए मैं डॉक्टर जगमती की तहे दिल से शुक्रगुजार हूँ। उनकी गाइडेंस से आज मैं अपनी डायबिटीज़ ठीक कर पाई हूँ। मेरा नाम
हेलो एवरीवन। मैं जागृति मैम से पिछले 6 महीने से ट्रीटमेंट ले रहा हूँ एंड मुझे काफ़ी इन्फ्लेमेशन थे मेरे स्किन पे। काफ़ी रेड स्पॉट्स हो जाते थे, बहुत इचिंग होती थी पाम्स में और नेक में, इवन लेग में भी। बट जब से मैम की से मैंने ट्रीटमेंट लेना शुरू करा है तब से मुझे काफ़ी काफ़ी आराम मिला है। और पहले मुझे एलोपैथी लेनी पड़ती थी दिन में 2-2 बार ताकि वो इन्फ्लेमेशन कम हो। लेकिन जब से मैम से मेरा कंसल्टेशन चालू हुआ है एंड मैम ने जो भी मेरे डाइट एक चार्ट बना के दिया है मुझे कि क्या क्या मुझे चीज़ें अवॉइड करनी है खाने में, क्या खा सकता हूँ मैं, जब से मैंने वो सब चीज़ें फॉलो करनी शुरू करी है तो काफ़ी मुझे आराम हुआ है। एंड एक और चीज़ जिसके लिए मैम को मैं कंसल्ट करता हूँ वो है मेरे को पेट की भी बीमारी है, मतलब मेरा डाइजेशन काफ़ी वीक है। तो उसके रिगार्डिंग भी मैम ने मुझे मेडिसिन के अलावा भी मैम ने मुझे एक डाइट चार्ट बना के बताया है कि ये चीज़ें यू कैन हैव। एंड मैं उसको फॉलो कर रहा हूँ पिछले 6 महीने से एंड उसमें मुझे उसमें जो वाकई में काफ़ी आराम हुआ है। जो पहले मुझे ऐसा हो जाता था कि अगर मैं कुछ भी हैवी खाऊं तो मुझे ऐसा लगता था कि आई नीड टू गो टू द टॉयलेट। सो नाउ मतलब जब से मैम की दी हुई मेडिसिन मैं ले रहा हूँ उससे मुझे काफ़ी आराम हुआ है। एंड अब मैं कुछ भी हैवी भी खा लेता हूँ बाहर का भी तो मुझे बिल्कुल भी अनईजी नहीं लगता स्टमक में। एंड I think that is something which is very relaxing because earlier काफ़ी प्रॉब्लम हो जाती थी कि कुछ भी थोड़ा सा बाहर खा लो, डर लगता था कि बाहर खा लिया कहीं पेट ना खराब हो जाए। बट जब से मैम की मेडिसिन ले रहा हूँ एंड मैम ने जो भी डाइट चार्ट मुझे बताया है तो दैट इज हेल्पिंग मी अ लॉट। सो आई लाइक टू थैंक यू मैम फॉर योर सपोर्ट।
My name is Anusha. मैं डॉक्टर जगमती के पास ऑलमोस्ट 5 महीने पहले आई। उसके पहले मैं ऑलमोस्ट साल भर से बिकॉज ऑफ माय थ्रोट इन्फेक्शन काफ़ी परेशान थी। मेरा थ्रोट में इन्फेक्शन हुआ, फिर लिम्फ नोड में इन्फेक्शन हुआ, उसके बाद मुझे एसिड रिफ्लक्स का प्रॉब्लम शुरू हो गया। तो मैंने काफ़ी सारे डॉक्टर्स को दिखाया और एलोपैथिक ट्रीटमेंट लिया, लेकिन फ़ायदा नहीं हो रहा था। फिर जब मैं डॉक्टर के पास आई तो मैं काफ़ी डिस्ट्रेस्ड थी, काफ़ी पैरानॉइड हो चुकी थी बिकॉज बार बार मुझे मेरे थ्रोट पे मेरे टॉन्सिल पे एक इन्फ्लेमेशन आ रहा था, एक पॉइंट डेवलप हो रहा था जो कि मुझे बहुत स्ट्रेस आउट कर रहा था। मुझे काफ़ी बुरे बुरे ख्याल आ रहे थे मन में कि ये क्यों हो रहा है बार बार। बट जब मैं आई उनके पास तो उन्होंने मुझे अश्योर किया कि ये कुछ नहीं है, ये दिस इज़ ऑल बिकॉज ऑफ एसिड रिफ्लक्स एंड ये ठीक हो जाएगा, बट आपको मुझे थोड़ा सा टाइम देना होगा, 2 महीने का 3 महीने का, एंड तब आपको रिजल्ट दिखना शुरू होंगे। और एग्जैक्टली ऐसा ही हुआ। इनिशियली तो हर हफ्ते मैं उनके पास आती थी 2 या 3 बार, एंड काफ़ी स्ट्रेस आउट रहती थी कि क्यों हो रहा है और बहुत परेशान। एंड वो काफ़ी पेशेंटली मुझे देखते थे, हैंडल करते थे, और उनको समझ में आ रहा था कि मैं बहुत ज़्यादा स्ट्रेस्ड हूँ। तो जितनी बार भी मैं उन्हें मैसेज करती थी या बोलती थी कि मैं आना चाहती हूँ, वो हर बार एक्नॉलेज करते थे उस चीज़ को। तो उसने काफ़ी हेल्प किया बिकॉज अगर एक डॉक्टर आपको अश्योर करता है कि आप ठीक हो जाओगे एंड इट इज़ नथिंग दैट यू शुड वरी अबाउट, दैट अश्योरेंस ट्रीट्स हाफ योर प्रॉब्लम इज़ व्हाट आई फील। एंड मेरे केस में मुझे लगा कि वो बहुत इम्पॉर्टेंट था। तो मेरे जो प्रॉब्लम्स थे जिनके लिए मैं उनके पास आई, वो लार्जली वाज एसिड रिफ्लक्स एंड द रिकरिंग थ्रोट इन्फेक्शन। तो जब मैं एलोपैथिक ट्रीटमेंट ले रही थी तो ये हो रहा था कि दे वर ऑल ट्रीटिंग द सिम्टम एंड दे वर नॉट ट्रीटिंग द कॉज, एंड बिकॉज ऑफ विच जैसे वो सिम्टम को ट्रीट करते थे वो थोड़े दिन के लिए सिम्टम सबसाइड हो जाता था, लेकिन बिकॉज द कॉज वॉज नॉट ट्रीटेड वो वापस आ जाता था। डॉक्टर जागमती ने मेरा पूरा केस सुना मेरे, और मैं काफ़ी अच्छे से उन्हें डिस्क्राइब कर पाई अपनी प्रॉब्लम, और मैं जो जो फील करती थी मैं उन्हें बता पाई, जिसके कारण उन्होंने काफ़ी मेरे मेडिसिन के कॉम्बिनेशंस को चेंज किया बार बार, और जिससे कि मुझे एग्जैक्ट मेरी प्रॉब्लम एड्रेस हुई और मुझे रिलीफ मिला। तो वो एक बहुत इम्पॉर्टेंट चीज़ थी। प्लस जब धीरे धीरे रिलीफ आने लगा और मेरा जो एक पस पॉइंट था उसका फॉर्मेशन बंद हुआ, तब उन्होंने मेरे डाइट पे काम करना शुरू किया बिकॉज उनका ये मानना था कि इट शुडंट बी दैट वी ट्रीट इट फॉर नाउ एंड इट कम्स बैक, इट शुड बी ट्रीटेड फॉर एवर। सो डाइटरी चेंजेस उन्होंने मुझे काफ़ी सारे बताए। लाइक उन्होंने मुझे कहा कि अब वीट का कंजम्पशन कम कर दीजिए। तो जब से मैंने वीट का कंजम्पशन कम किया, मुझे खुद को फील हुआ कि मेरा जो एसिड रिफ्लक्स है वो बहुत हद तक सबसाइड हो गया। क्योंकि पहले मैं फील करती थी कि एसिड ऊपर आ रहा है या मेरे पेट में कुछ गरम गरम सी फीलिंग हो रही है, विच मीन्स दैट द एसिड हैज स्टार्टेड टू फॉर्म। बट आफ्टर डूइंग दोज डाइटरी चेंजेस, जैसे खीरा खाना बिफोर both my meals in lunch and dinner, फल खाना, मे बी एप्पल और पपीता, और गेहूं के आटे को सब्स्टिट्यूट कर देना चने के आटे से, या रागी ज्वार, मिक्स ऑफ एवरीथिंग, that helped me a lot. And I think I'm really happy, really grateful to Dr. Jagmati कि उन्होंने इतना पेशेंस रखा मेरे साथ। इट हैज़ बिन अ लॉन्ग जर्नी, आई मीन द जर्नी इज स्टिल कंटिन्यूइंग। उसके बाद उन्होंने मुझे प्रोबायोटिक्स सजेस्ट किए जिससे मुझे बहुत फ़ायदा हुआ। First she gave me probiotics for 10 days, then when it gave us results we continued another 10 days, and then now we've moved to a higher level of probiotics, which is also helping me a lot, which is keeping my gut at good health, which is controlling my acid reflux and giving me good digestion, and the throat problem is not coming back, uh, which is a good thing. And I think homeopathy is a form of medicine which maybe personally I never trusted. But after meeting Dr. Jagmati and after seeing the results myself, my trust in homeopathy has really increased, and I have recommended Dr. Jagmati to my brother.
कीर्ति आई वॉज अ पेशेंट ऑफ PCOS। मैम की एडवाइस से मैंने अल्ट्रासाउंड करवाया था जिसमें सिस्ट डायग्नोज हुई थी। तो जब से मैं डॉक्टर के पास आई हूँ मेरे PCOS में काफ़ी रिकवरी है। मैम ने मुझे मेडिसिन भी दी और उसके साथ मेरी डाइट में भी चेंज करने के लिए बोला था, जिसमें मैम ने कहा था कि डेयरी प्रोडक्ट्स बिल्कुल अवॉइड करने हैं, गेहूँ अवॉइड करना है। तो पहले जो था मैं डेयरी प्रोडक्ट्स में मिल्क डेली कंज्यूम करती थी, छाछ डेली लेती थी, वो मुझे नहीं पता था। बट मैम के एडवाइस के बाद ये सब मैंने 4 महीने से बिल्कुल स्टॉप कर दिया था। तो डाइट में चेंज की वजह से और विद द हेल्प ऑफ द मेडिसिन अब मेरे को मेरे पीरियड्स डिले नहीं होते हैं और रेगुलर बेसिस पे आते हैं विद नॉर्मल मेडिसिन ओनली। पहले भी मैं होम्योपैथिक ट्रीटमेंट ले रही थी बट इट वाज नॉट क्वाइट इफेक्टिव, जिसमें कि मुझे SOS मेडिसिन लेनी पड़ती थी पीरियड्स जिसे आ जाए। लेकिन यहाँ पे आने के बाद जो नॉर्मल होम्योपैथिक मेडिसिन है और विद द हेल्प ऑफ डाइट चेंज मेरे पीरियड्स अब रेगुलर हैं और मुझे कोई SOS मेडिसिन भी नहीं लेनी पड़ती।
I have completed my today's topic. At the end, I want to say a very special thank you to Dr. D. Vasu sir, because without his help, this topic was even I was not able how to uh, make a easy presentation for it, but he has helped me a lot so that it can be presented easily, it can be understood easily by everyone. So very grateful to Dr. Divasu sir. Thank you everyone. Sharma sir.
Thank you. Thank you, Dr. Jagmati, for your
Thank
very
you
nice
sir.
presentation. It was very informative and it is a very new concept.
Thank you
In
sir.
homeopathic practice, whenever there our medicine after prescribing, we are not getting any desired result. Usually, we think that probably our medicine selection is not was not correct, and we
Yes.
think the further in this direction only whether if this medicine has not acted, so let us see what are the other similar medicine, or is usually recase taking, rerepertorization, prescribing from the miasmatic point of view, or the other different aspect. But
Yes.
most of us, we usually don't think from the other perspective, though theoretically we know there are the different obstacles to cure, and theoretically everybody we know that how important the diet is in the for the maintenance of the health and the nutrition and for this recovery. But its practical utility, whatever you are prescribing, that is usually and you are getting very remarkable success that will inspire us on all these other viewer. So think further to inquire much more about this role of nutrition, and they will acquire knowledge, and this thing will help in our everybody's practice. And you have though the topic is number one, it is new topic, and number two, the topic it is vast, of course. So that's something I think you have missed it probably due to this time constraint. Dr. Odhikari used to say this often, that a priori, that there is the beginning of the beginning. So this pH balance, when I inquired about the thing and discussed with the dietitian of our hospital, so I came to know about this. There is that is known as the alkaline diet. The
Yes.
alkaline diet, because this thing alkaline diet, this concept that has been derived this first time by this French biologist Claude Bernard, who what happened experimentally, he changed the diet of this rabbit from the herbivore diet to the carnivore diet, and he saw that the urine turns alkaline to acidic of this rabbit. So after that, what happened? He combusted different food item into the bomb calorimeter and investigated the chemical properties and pH of the constituent of the remnant of the food, which is known as the S. he proposed dietary as hypothesis, and as per this hypothesis, that the food when metabolized would leave a similar remnant, either it will be acidic or alkaline after oxidized in the body or combustion. So this, on that basis, this food has been categorized by this nutritionist who believe in this line, like there are the alkaline, this diet or dietary as hypothesis. They consider that all this, the by the nature of this or the pH of this food, we cannot consider the food is alkaline or the acid, but
Yes.
after its complete digestion or its combustion or oxidation, the remnant that will remain into the body, this will be considered the nature of the food. Accordingly, it is alkaline diet or acidic diet.
Very true, sir.
So this thing, after that what happened? There were the further, the many people work on it. Like there are the another person whose name is the Robert O. Young, who this actually promoted the alkaline diet for weight loss, and many other people, they tried it for this rheumatoid arthritis. Even the many people goes further that it is related with that of the cancer, though there is no such direct correlation in the from the experiment. So, and this cross sectional data, usually it is lacking, supportive data is lacking in correlation, whereas for the cancer it is seen that due to excessive cell proliferation, the medium, the area, it become acidic as a result of cancerous proliferation, but the acidic medium, acidic environment does not produce cancer.
Yes.
And but what happened, though this in medicine historically such kind of this diet was used to prevent the recurrence of nephrolithiasis and recurrent UTI. Alkaline diet was used, but no such scientific data is there to show that the such kind of the this acidic diet, they can turn the urine acidic, and alkaline diet, they can increase the pH of this urine. Consistency is not there.
Yes.
Now there is what happened, this proponent of this theory, they have come up with the certain other data from the environment, that in the last 100 years the pH of the ocean, that has usually dropped from 8.2 to 8.1, and that may be one of the reason for the destruction of this coral reef, and due to this industrialization of the last 100 or 208 years, where usually the increased carbon dioxide deposition there.
Yes.
And even in this pH of this soil, though it is usually in between 6 to 7, so it turns many a times this acidic, and when we use dolomite or these other manures, that also increases this pH of this soil, that is required from time to time. So they considered as our pH in between 7.35 to 7.45 blood pH, that is to some extent alkaline. So for the maintenance of this alkalinity of this our environment, this body fluid, the food we should consume, they should have some kind of alkalinity. That is their theory. And in this recent, if we consider the dietary changes in the post-industrialization era, so if we, some points if we see, like the in our diet, so the amount of potassium intake that has been significantly reduced, and sodium intake that has been significantly increased. Whereas this chlorine consumption has been increased significantly, whereas bicarbonate consumption has been decreased significantly. So this thing, as a result of which our internal environment, this is going to change, though our regulatory mechanisms, though they are so robust. So it is very difficult by this consumption of the very kind of the food. by changing the pH of the blood. It's very, very difficult, though it is usually possible to change into the pH of this urine. So for this reason,
Yes.
many people, they don't this consider this is usually kind of the thing is like the easy acceptable, or scientifically is usually what is happening very easy to accept. Now the today's diet, in addition to that, it is poor in magnesium, fiber, and rich in saturated fat and simple sugar,
Yes.
sodium, and the chloride. These are the
Yes.
additional problem. In addition to that, for the aging population, there is gradual loss of renal acid-based regulatory function. As a result, increase in the diet-based metabolic acidosis, while in a modern diet. In a low carbohydrate and high protein diet, there is increased acid load, results in very little changes in blood biochemistry and pH, but results in many changes in urinary chemistry,
Urine.
magnesium level, citrate, and this fall in this pH level, urinary calcium level, undissociated uric acid, and phosphate and increased in phosphates are increased. All these are actually this known risk factor for this formation of this urolithiasis.
Yes.
So these are this the different viewpoint that I could add, and if you think that you also can add something, you can add to this.
No, you have already given, in fact, extra information for today's topic, which is great. I was also knowing few points which you said now, but was not knowing the whole. You have given many new points also actually. But during the treatment, I felt instead of the reports, if the patient's symptoms, which are the main troubling to the patient, when they are getting better, why not to give something extra or better for the patient in a very short time? And instead of changing the medicine, even after careful case taking, selecting, repertorization, one should, if not getting the result, they must think about changing this. But I will surely advise before changing the diet of the patient, one has to try it himself first. If we are able to follow it, then we will be able to convince the patient. Many times, patient in my practice also, they said in the beginning, actually, this type of diet, me and my family, we are following since last 2 years, and we are able to see the changes. We advised in the surroundings, we were able to see the changes. So when I convinced the patients also, they said, "No, doctor, this is not possible to stay without the tea. We can't say we are from the beginning we are drinking milk. We can't stay without it. What will happen to our calcium level?" But when I told them that you just start with the 1 month first, see the difference in yourself, in your health. So advising to the patient with the reason, they will be convinced and they will be able to see the difference. Before convincing the patient, doctor has to be convinced himself first. This is very important, I think.
Yes, thank you. And in addition to that, like we homeopathic physician, maximum of us we are engaged in private practice, and in private practice we are general physician. And general physician
Ye-
is just like jack of all trades. That we are not master in anything, but we should have basic knowledge of food and nutrition. We should have basic knowledge about this physiotherapy and like the counseling of everything. So, and this patient's attitude towards us, like it is different from that of the when they are going or visiting this chamber or clinic of any allopathic physician. If we advise some person's patient that you go for CT or the MRI, they will think twice, and if the report comes normal, then many of them they will think it is this doctor, they is the actually wasted my money. But
Yes,
in the third world countries, so we have to look in a different way. And for this reason, what happened, we homeopathic physician, we have moduled ourselves that like the right handed person, they utilize the right hand most, and the likewise left handed person use the most. So we utilize our what is the strength of us who are very good in repertorization. So their prescription is repertory based. Who are very good into the have the very knowledge of the this practice of medicine surgery. They always to go with this actually in this line of this diagnosis and all these things. Who are very good in mathematics. So their prescription is based on the mathematics. But whatever the mode of the prescription, if we add something, some knowledge of this physiotherapy, something in the knowledge of this food and nutrition, some knowledge of this counseling of this patient. So this
Yes.
will only increase this our efficiency of patient management, and ultimately the it is our individual benefit side by side. The homeopathy, the that will also that be the indirectly the benefit of this homeopathy also. So from
Yes.
this thing, it is my humble request, not only for the viewer to myself, that we will try to acquire knowledge about the thing, and though not all the new thing they appears the as good as they are, but we should try. It is not like this after the lecture of this Dr. Jagmati that everybody will start this thing, but let us try. Why not this? Let us try in this line, acquire the knowledge, and let us advise our patient accordingly, and try to find whether we get any additional benefit or not. And very few like the people who are practicing in a government hospital where there is the facilities of this physiotherapy, yoga therapist, and that of the your dietitian. So we need not to bother, but the other people we have to think. So there are the many obstacles of this cure, and in spite of our very good prescription, correct prescription, the many times desired result we are not getting, and then we try to change our prescription, and ultimately there is no benefit. So this is all from my point of view. Now it is expected that as the topic is new, the many questions will come because the topic is debatable as
Surely.
well. So as
I
this
will try
as
my
the
best.
as this proponent of this topic, they are like the goals very high, but there are this, as for example the British Dietetic Association, they called this such kind of the alkaline diet theory as the nonsense. They have called this alkaline diet one of the top 5 most select diet to avoid in 2018. American Institute of Cancer Research has called alkaline diet as myth. So as it is new, the controversy they are bound to prop, but in spite of that, let us try to whatever the information we have received this from Dr. Jagmati, we will try to find out, try to implement if she is getting the result. So let us, if we will get the result, we will carry on, and if not, so it is very easy to drop this idea.
Very
And
true, sir.
thank you, Dr. Jagmati, again. So you have paved a very new path for all of us. Though we are usually into the field of this education, like the food or nutrition, that is a part of my subject. But for this pH balance, I was not aware of, and it is due to you. I will try to learn more, and hope all these viewers they will also try. And if there is any question, please let me know that I can ask Dr. Jagmati. If any question, Dr. Bidyut sir and Dr. Kalyani sir.
There is one question. First of all, thanks. It's to our inaugurator, Dr. Sudhan, our moderator, Professor Abdul Motin Molla, and obviously our speaker, dear sister Jagmati. And this is the beauty of N.I.H Alumni Association CME platform. Something new, order separate, propelled by our master Samuel Hahnemann, and we are trying to unleash certain new aspects. Now, there is one question from Dr. Preetha Mehra. Please put light on millets please put some light on millets instead of wheat. And what is the reason for rise in cases of gluten allergy? How hard it is. It's on the screen, Dr. Jagmati and Professor Motin. What is the reason for the rise of cases of gluten allergy? How to handle it? Right, how to handle it?
Sir, for the gluten allergy, I advise the patient to avoid the wheat also, because nowadays we see every second patient feel bloatedness, gas, acidity. So after reducing this component in the diet, they were feeling the changes in their problem. And for the rice, it is always good to take rice. There is no harm in that. But it is better to add some veggies also into it so that it is giving the not becoming bad for any acid formation or for the sugar. All this can be managed very well when we add more of vegetables to that.
And
Uh,
sir, regarding the rise of this gluten allergy, the things is all kind of the allergy in general they are increasing. Number one.
Yes.
Number two, at present, this the diagnosis of the disease is being reporting is being more. So this thing is also one of the reason why it is increasing. And number two, the consumption of the wheat component. Suppose in West Bengal, the earlier, the more than 90% of these people, they were exclusively rice eating people. But as a part of this, even the many people they are consuming the one meal of rice and another meal their consumption of this atta, the wheat product, and there is increased consumption of this wheat based food, including like that of the your different kind of the biscuits, the fast food which contain the maximum maida. All these are the derivative of this wheat. So that this thing is increasing, and probably that is the reason that the number of the gluten allergy is increasing. Rather than I don't think the increasing of this allergy in general, and as a part of it, it is increasing, and until and unless you are exposed to this allergen, so there is no problem. Probably that is the reason, but the exact reason of the allergy nobody knows. And for this gluten allergy, so that is the same. As per my knowledge concern, there may be the any other reasons that I don't know. Thank for questioning.
Thank you. Thank for explanation by Dr. Jagmati and Professor Motin. And we have a competition for the live viewers. The first two speaker means persons who take on the quiz for the CME will be brought on screen. And tonight we'll be having probably Medico or Dr. Shoaib Ahmed. I'll request Orko, one of the winner, uh, Dr. Shoaib Ahmed on screen. He will be allowed to ask one question to the speaker.
Yes, sir. I have no
Shoaib,
question. Thank you so much. I have. Yes, sir. Yes,
okay,
sir.
Shoaib, thanks for
I have.
participating in our quiz. And which college, means which institution are you from?
Sir, I am final year. Final year, Mednapur Homeopathy Medical College and Hospital.
Okay, Medico, Shoaib, congratulations for being in the CME, and we like young generation blood like you. How you like the show tonight, the new topic altogether?
Okay, sir. I am so interested that I have no question. I understand, sir. My enjoying, but I have no questions. Thank you so
Okay,
much.
that's great. And I request you and to spread the information of our CME. Thank you for being in the show, Shwed. Uh, I like to thank all the
Thank you so much,
viewers
sir.
today. Thank you. And I like to thanks all the 82 live viewers who are live now, that you are hearing a topic, you are means listening to this CME in spite of World Cup, ICC World Cup match between India and England going on. The score is 128 for 9. But in spite of all that, I salute all the viewers who are in the show to view this. I'll request our president, beloved president, Dr. Kalyani sir, to share his views. Over to you, Kalyani sir.
Thank you, Dr. Bidyut Mukherjee, our beloved secretary, competent secretary, I should say. And today's theme is a brilliant theme, I can tell you. Excellent theme, new picture, new field, that has been excellently contributed by Dr. Jagmati Singh, our beloved sister, and Professor Abdul Molla, beloved brother. Excellent contribution. He worked not only as moderator but also as contributor for the CME. This chapter, every one of us must keep concentration on this diet management because it has been applied by our master itself long years back. Nowadays, we are busy with the diet management, but it has been clearly explained by our master long years back. That has been neglected by us. It was unfortunate. We must think of the physiology to make the physiological balances comfortable as per the individual is concerned. We must concentrate on the diet. And as we are unaware of the diet, that's why we are suffering so much. Majority of our sufferings, as I'm saying, we purchase it from market. As we are talking about the wheat, allergy factors, such sugar, acidic food, non-veg, we purchase our system from market. That should be controlled, restricted. We should learn it because of our ignorance regarding the diet. With clear conscience, Jagmati as N.I.H express, let it be first tested in our own family to get confidence among ourselves. Then we will learn, we will acquire more knowledge that will be spreaded and given to the patient with confidence. So brilliant experience of CME today. Gradually, these N.I.H alumni series are increasing in heights of intellect. Many thanks, madam. We will expect and we will wholeheartedly expect that you will grow more and more with your subject and will contribute in near future much more. Dr. Motin, please, your appearance is much encouraging to all of us. Commit your friends and other colleagues to come forward to participate in the CME as speaker or moderator. Your moderation is beautiful and your contribution was extremely nice. Anyway, this CME will be over the asset of our alumni association, obviously. Thank you all for the nice CME.
Thank you, sir. Thank you, sir. And as the month of festive season, the Diwali is approaching on 12th. Our next CME will not be on 12th, will be on 19th. Though it will be a World Cup final day. We'll all pray for India to be in the final, but still, we will be there on 19th. And the alumni meet is approaching. This year, we will be having our alumnus meeting in northern part of India, the northern chapter. There will be, they had already finalized on 24th of December. Dr. Jyotsna Tandon, Dr. Mukesh Singh, they are arranging all the things along with their team. Dr. Naim, our assistant secretary, is there. And on 10th of December, as decided by the executive committee, we will be having a short program by garlanding the Hanuman statue, and there will be a cake cutting ceremony. We will be finalizing it very shortly and we'll be publishing it in our regular groups of WhatsApp and Telegram. Kalyani sir, there is something I was pondering on in the backstage today uh, about certain topics which we can't think over. Like when Jagmati, we approached Dr. Jagmati to speak on this topic, she was very anxious that whether this will be loved or taken over by the viewers, the audience or not. I encouraged her and she had worked lots. I really admire the work done by Professor Abdul Motin by talking to his dietitian and getting himself ready to be a moderator. And I also thank our very senior pro second batch, Dr. Sudhan Dhar, to be here tonight in this CME for the first time. But we have some other aspects, sir, like supplementation. Few days back, this is something to ponder on all of us. Few days back, in another All India Homeopathic group, some doctor had given a vitamin B12 supplementation leaflet in the group. It's not the alumni group, it's some other doctors group of some reputed doctors all over India. And few senior or junior doctors had started screaming, "Arey, this is not homeopathic vitamin B12, this is allopathic." All the viewers tonight whether we, the homeopaths, can prescribe baby food, can we prescribe vitamin D, can we prescribe vitamin B12, or can we prescribe separate calcium apart from calcarea phos? So these are certain things to ponder upon. And my request to Dr. Kalyani sir that we will ask our respected fraternity of N.I.H alumni to come forward with their database and be a speaker on the CME. I know a lot of very senior and very successful practitioners of homeopathy today from NIH alumni faculty across the globe. They are using supplements. If we need a calcium supplementation, shall we refer that patient to a allopathy or can we prescribe? I'm not asking answer from any of you over here tonight, not from Kalyani sir. We can discuss after this live show in the backstage. But these are certain things to ponder, and we request our speakers to come forward. Kalyani sir, do you agree with my views, sir? Kalyani sir.
Bidyut is a good, very good idea. Bidyut, oh, very good idea. Bidyut, oh, very good idea. Bidyut, oh, very good idea.
Sir, can you hear me?
Supplemented
So views
or
on
vitamin
tonight's
containing
CME.
foods to supplement different vitamins in diet. It will be more easier for homeopathy system to
Okay, sir is
accept.
there. Right, sir is there. Sir is there.
Right, sir is there, sir. Right, sir is there, sir.
Orko? Orko?
Yes, how may I help you?
Orko? Orko?
It's echoing from your side.
Okay, okay.
Okay, okay.
Yes.
Orko is sir there?
Am I audible now?
Yes, sir.
So regarding this subject, vitamin supplementation through foods, that will be a very fantastic item of CME. And what I found today that Professor Abdul Motin Molla will be a great help in that CME. We can call both of them in a separate CME to contribute on the subject. Anyway, with lot of thanks to all on the screen, viewers and those will be viewing later on. Really, many, many thanks from alumni assistant to be with us and to encourage our potentiality. Your presence, your appearance, that will encourage us very much to continue this program. Thank you very much. Bidyut, please.
Thank you, sir. And with your permission, Sudhan, before that, Sudhan, your views, Dr. Sudhan Dhar.
Hello.
Dr. Sudhan,
Uh,
please try to come one as a speaker, also
Hello.
with your experiences. You
yeah,
are audible.
Sudhan, we
You are
can hear
audible.
you.
Oh, many thanks, Vidyuda, for this CME and session and for the topic, which we don't have much knowledge about this.
Very good. Very good. That's awesome. With this, we return back to Orko Mukherjee.
Thank
Over to
you,
you, Orko.
N.I.H Alumni Association. Thank you, Bidyut. Thank you, Kalyani sir. Thank you, Sudhan Dhar. Thank you, Dr. Jagmati. Again, good night.
Thank you and good night.
Thank you to all.
Thank you.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you want an auto e-generated certificate for today's e-participation certificate, all you have to do is just click on the link given below. You have to answer a few questions and you have to answer it right and give all the details, all the required details asked over there in a corrected format. I have seen many of the peoples are giving emails in a wrong way, like they're putting extra dots or doing the names like Gmail, typing the Gmail name wrong, or sometimes doing gmail.in. Just check it. Please check your email once and then only put the details. And one more thing is that we have opened a WhatsApp channel. The link is also given in the description. You can join over there. We give updates over there too, regarding any type of CMEs, and also the quiz link. The quiz link is also given over there, means it will be given over there, and on every CMEs, every link you will be getting a quiz link. So whenever you will join the group, we will see, and we have a common discussion group too on the Telegram channel. While after join, whenever you just join the Telegram channel from the below link, we have a Telegram channel too. From the Telegram channel, whenever you will join the below link, there is an option to join the common discussion group too. So you can also join over there. You can join on the common discussion group, and if you have doubts regarding any type of doubts regarding CMEs and other things, you can ask over there. You can share your views. You can talk with other viewers over there. We have opened the portal for there, and also follow us on Instagram and Twitter, and also like our Facebook page, as we are trying to uh, start start this Facebook live too again. This CME was failed to occur on Facebook and Twitter, but I hope from the next CME we will not be facing this issue. We are trying to do our best, and we all need your support, and with your support it will be our chance to rise up again, and we are close to 200 and 2100 subscribers. So thanks to all the new subscribers who are subscribing right now and will be subscribing on future after watching this video. And if you haven't subscribed yet and only watching this, please make sure to subscribe our channel. The red button is given right beside our name, so click on that, click on the notification bell, and click on all notifications to get updated over there too whenever we schedule the CME. So with this, I say goodbye to everyone until our next CME. I hope to see every one of you return on our next CME. Until then, it's me, Orko Mukherjee. living, and it will be time for post CME talks. Bye bye, guys.